Hello, everyone, and thanks so much for joining us for today's presentation, Help with Hep C, presented by the HealthWell Foundation. I'm Carla, the Director of User Engagement at NeedyMeds, and before we get started, I'd like to offer some tips so you can make the most out of today's presentation. First of all, you can ask questions at any time by typing them into the questions section of your GoToWebinar control panel. Just know we will reserve answering questions until the end. If we don't get the chance to answer your question, we will follow up with you by email. But of course, we will provide the contact information for both NeedyMeds and the HealthWell Foundation at the end. This webinar is being recorded and will be available on the NeedyMeds YouTube channel. And as I mentioned, you can find our PowerPoint slide decks and other materials we thought you'd be interested in that handout section of your GoToWebinar control panel. So let's dive in with what is NeedyMeds. For those of you not familiar with us, we are a national nonprofit founded more than 2 decades ago by a retired family physician, Dr. Richard Sagel, and his friend, Libby Overly, who is a medical social worker. Rich is still the NeedyMeds president. On the screen is our mission statement, a statement about how we achieve that mission, and our vision statement. But simply put, NeedyMeds connects people to programs that will help them afford their healthcare expenses. And we do that free and anonymously through our website, needymeds.org, and our helpline, 1-800-503-6897. So what you're looking at now is the home page of our website, which is really the face of our organization. And I always like to put a screenshot up so you can see what needymeds.org looks like. And it also gives me a chance to point out a few resources. Obviously, and hopefully you can see, our website is really full of information. So I encourage you to browse the site further when you have time. For now, as I said, I'm just going to point out a few resources. First of all, if you are looking for healthcare cost savings programs, you can begin your search with that Healthcare Savings tab. Next to it is the Education tab, which is where you'll find our educational information. And that's where you can sign up for our webinars, our monthly newsletter Vitals, order brochures, order our drug discount card, for example. So I also mentioned that today's webinar is being recorded, and you will be able to find that recording on the NeedyMeds YouTube channel, which is at the top right of our homepage with the rest of the social media icons. And I suggest subscribing. That way you'll be notified when new content, such as videos, webinars, or presentations are added, and that way you won't ever miss anything. And you can also check out and register for future webinars on the calendar of events on the bottom right hand of our screen. Now, as you saw on that screen that showed our mission statement, a big part of our mission is educating people. And of course, we do that by educating people about NeedyMeds and the healthcare savings and educational resources we offer, but also by sharing other resources and expert information from our partners, which is why we are so pleased to have my friend and colleague, Jeremy Abundi from the HealthWell Foundation here with us today. So before I introduce Jeremy, let me tell you just a little bit about the HealthWell Foundation. They are a leading nonprofit dedicated to improving access to care for America's underinsured. Their mission is to reduce financial barriers to care for underinsured patients with chronic or life-altering diseases. Basically, when health insurance is not enough, they fill the gap by assisting with copays, premiums, deductibles, and out-of-pocket expenses. But the HealthWell Foundation also has an ongoing commitment to the hepatitis C community and assisting Hep C patients in need of medication copay assistance. During this webinar, participants will learn about hepatitis C, available Hep C resources, and very importantly, how easy it is to apply for a Hepatitis C Fund medication copay assistance grant. Now, let me tell you a little bit about our guest who is going to walk us through all of this. Jeremy Abundi is the Manager of Provider and Pharmacy Relations. He joined the HealthWell Foundation in August and serves as a liaison to physicians' offices and pharmacies. To ensure familiarity, I never get that word right, I'll try again, to ensure familiarity, still didn't nail it, but you guys get what I'm saying, with our programs with their programs and processes. And Jeremy is responsible for coming up with the most efficient methods to increase stakeholder engagement on behalf of the patients HealthWell serves. Bringing over 16 years' experience in healthcare patient assistance, patient advocacy, and program administration to the foundation, he most recently served as Director of Corporate Responsibility, Government Affairs, and Public Policy for the Mallinckrodt Pharmaceuticals. Jeremy has a master's in healthcare administration from the University of Maryland, University College, and a BS in kinesiology from the University of Maryland, College Park. So as you can see, with that resume and his commitment to helping people, and certainly his advocacy at the HealthWell Foundation, why we're so pleased to have Jeremy here to explain the Hep C Fund and how it can help the Hep C community. So without further delay, and hopefully seamlessly, so bear with us, I'm going to go ahead and pass the mic and the screen to Jeremy. And as he grabs that, I will remind everybody that if you do have questions, you can absolutely feel free to type them into that question section of your GoToWebinar control panel, and we'll do our best to get to those at the end of the presentation. Thanks so much, everybody. And with that, Jeremy, I'll pass the mic to you.
Great. Thank you so much, Carla, for that warm introduction. Hopefully you're all able to see my screen at this point. Hello, everyone.
We're good to go.
Great. Good afternoon, everyone. Thank you so much for joining me today for Help with Hep C. Really excited to be here with you today, and very thankful to NeedyMeds and Carla for giving us this opportunity. So thank you again, Carla, for sharing this opportunity with us. Really appreciate it. As Carla said, my name is Jeremy Abundy. I am the Manager of Provider and Pharmacy Relations here at HealthWell Foundation. And we're going to cover a lot of information today in this webinar. So if you have questions that come up throughout this program, or you think of something later on after today's webinar, my contact information will be in a later slide. Please feel free to reach out to me directly. I'm happy to answer any and all questions that you may have relative to our Hepatitis C Fund. So with that, before we get started, I wanted to do a quick level set of the topics we'll be covering today. I'm going to provide you with an introduction to HealthWell Foundation, give you a very brief overview of hepatitis C and what exactly that means. Then we're going to highlight our alliance partners and our outreach efforts within the hepatitis C community. Once we've completed that, I'll do an overview of the Hepatitis C Copayment and Insurance Premium Assistance Fund. We'll discuss fund requirements and the grant process. And I'm going to highlight the impact of our Hepatitis C Fund program for you. But the most important thing and the point that I really want to drive home and have you take away with today, if you learn nothing else on this webinar, is this key takeaway. And you're going to hear me reiterate it throughout the webinar. But the fact of the matter is we have a Hepatitis C Fund. It's open and assistance is available. And really no Hepatitis C patient in the US who meets HealthWell Foundation's insurance, prescription, and income criteria should have any co-payment obligation for their Hep C medications, either now or for the foreseeable future. Once you've heard this webinar and you think you may meet the criteria, by all means, give us a call, go on our website and apply. Assistance is available and we're here to help you. So please feel free to reach out. One housekeeping note about today's webinar. I'm going to discuss the grant process, but I'm not going to go through it step by step as far as how to apply for a grant. We actually have an upcoming webinar with NeedyMeds in July. It'll be airing July 21st. That goes into more detail on the actual application process. It's called Copay or Premium Financial Assistance in Less Than 5 Minutes, and that will walk you through step by step exactly how to submit an application. But don't fret. I don't want that to hold you up from applying. If you have questions about the process, like I said, I'll give you my contact information later on in the presentation. And feel free to reach out to me in the meantime to ask any questions that you may have related to the application process. All right, so let's get started. You may be asking, if you're not familiar, what exactly is the HealthWell Foundation? HealthWell Foundation, as Carla mentioned, is an independent 501c3 national organization. We're based in Germantown, Maryland. We were established in 2003 to improve patient access to life-changing medical treatments. And since launching in 2004, we've offered assistance across 80 disease funds. We were the first foundation of only 2 to have a written OIG opinion to operate funds open only to Medicare beneficiaries. And currently, 88% of our grantees are Medicare patients. 100% of donor dollars go directly to patient grants and services. And as of December 2020, we had approximately 160,000 active patient grants in our system. Since our inception, HealthWell has paid over $2.1 billion to over 615,000 patients via more than 930,000 grants. And you're looking at a list of those grants. This is a lot of information, and we're not going to go into this in detail. But as I mentioned, since awarding our first grant in 2004, we've been proud to provide assistance across a wide variety of disease areas. And you'll notice that hepatitis C is in fact listed as one of those funds. Okay, so now you're familiar with HealthWell, you know a little bit more about who we are and what we do. Let's shift gears and discuss Hep C just for a brief moment. According to our alliance partner, the American Liver Foundation, hepatitis C is a disease that results from the hepatitis C virus, or HCV, infecting the liver. The other common hepatitis viruses are hepatitis A and B, which differ somewhat from HCV, both in the way that they are spread and how they are treated. HCV usually produces no symptoms or very mild symptoms in the early stages. In fact, many don't even know they are infected until they experience liver damage, which sometimes isn't discovered until decades after they've been infected. HCV can be both short-term, lasting up to 6 months, which is also known as acute hepatitis C, or long-term or chronic hepatitis C, which does not go away. About 75 to 85% of those infected by the Hep C virus will develop chronic HCV. So you may be asking, what are the risk factors of contracting HCV? And there's a number of them. In addition to sharing needles, other risk factors include using unsterile equipment for tattoos or body piercings, coming in contact with infected blood or needles, receiving a blood transfusion or organ transplant prior to July 1992, receiving a blood product for clotting problems made before 1987, needing blood filtered by a machine, i.e. hemodialysis, for a long period of time due to kidney failure, being born to a mother with HCV, having unprotected sex with multiple partners, having a sexually transmitted disease, and having HIV. So you're familiar with HealthWell. We've talked a little bit about what Hep C is and how what the risk factors are associated with it. So let's take a deeper dive into HealthWell's ongoing commitment to the liver and hepatitis C communities. As you may know, copay and insurance premium assistance is HealthWell's calling card, and is more than likely why you're joining me today on this webinar to learn more about our Hepatitis C Fund. But did you know that since 2015, the HealthWell Foundation has been an active and committed member of both the liver and hepatitis C communities? Our dedicated focus in these communities is exemplified not only by our Hepatitis C Fund and that opening, but also the opening of the Hepatocellular Carcinoma Medicare Access Fund. But our dedication to the Hep C and liver communities doesn't end with the creation of those funds. We've worked tirelessly over the years to cultivate lasting and impactful relationships with our alliance partners in the liver and Hep C communities, with the goal of expanding the reach of our funds. And with that, I want to take a few minutes to acknowledge and highlight those partnerships. So as I mentioned, our dedication to the liver and Hep C communities dates back to 2015 and the opening of the Hep C Fund. And the success of that launch is due in part to our ongoing alliance partnerships with nonprofit organizations such as American Liver Foundation, Community Liver Alliance, and Fatty Liver Foundation. Together, we've worked to educate liver patients, caregivers, and providers about the Hep C Fund, viral hepatitis risk factors and available treatments, and overall liver wellness. And as part of our continued efforts, we were pleased recently to join the National Viral Hepatitis Roundtable. That's a national coalition working to eliminate viral hepatitis in the US and improve the lives of those affected through advocacy, education, and support to national, state, and local partners. One of NVHR's key tenets is to amplify the voice of people who have lived with viral hepatitis. And to that point, NVHR launched hashtag Voices for Hep in 2019. That's a network of 200+ patients, providers, and community advocates, and provides a way to connect, gain support for local initiatives, and access resources. So we highlighted some of our alliance partners, but beyond those partners, our marketing and communications team does a fantastic job of leveraging a number of platforms to further disseminate our hepatitis C outreach efforts. And to illustrate that point, I wanted to include this slide just to touch briefly on some of those other outreach initiatives that we have surrounding hepatitis C. Here you'll see highlights of some of the efforts we've had in the past year, including participation at the liver meeting in November of 2020, social media posts highlighting Hepatitis Testing Day on May 19th, and Hepatitis Awareness Month in the month of May. And finally, digital ads we've placed surrounding our Hepatitis C Fund in HepMag. Another critical tool in our efforts to educate patients and healthcare providers is our Real World Healthcare blog. If you're not familiar, the blog features compelling content on healthcare issues affecting Americans, and is followed by more than 11,000 industry execs, patient support organizations, health systems, academic institutions, government agencies, and NGOs. And in this example that you have here in front of you, this is from our May 2021 edition, which focuses on Hepatitis Awareness Month and shines a light on two of our alliance partners, National Viral Hepatitis Roundtable and Community Liver Alliance. If you're not familiar with the blog and not already receiving the alerts, I'd strongly encourage you to sign up for those alerts. You can do that very easily. Visit our website, healthwellfoundation.org, click on the About tab, and then select the RWHC blog from the drop-down menu and enter your email address to receive those alerts. So you're familiar with HealthWell Foundation and our outreach efforts as they relate to liver and Hep C. So let's take some time to review the Hepatitis C Fund and the details surrounding how to apply. So here you see another valuable tool in our outreach efforts. This is our Hep C Fund card that was created for distribution to patients, providers, and pharmacy. And this card tells you everything you need to know about the Hepatitis C Fund. First and foremost, the status is open. Our fund is open and accepting applications. We encourage you to apply or apply on behalf of your patients. It's a copay and insurance premium card, and insurance premium is actually a new offering that we just added recently. We're extremely excited to be able to offer, in addition to patients that have copay assistance, for those that have premium assistance needs, we're able to assist with that. The maximum award level for this fund is $30,000, and the fund card type is it's a pharmacy card fund. And what that means is if you're approved for copay assistance, you'll receive a pharmacy card to be utilized in conjunction with your insurance to pay any copay costs associated with your Hep C medication. And I have an example of what that card looks like in a later slide that we'll touch upon. Finally, two things: minimum copay reimbursement amount for this fund. There isn't one. So there's no minimum amount in order to receive reimbursement if that's the option that you elect. And most importantly, household income limit. To qualify for this fund, you must have a household income of less than 500% of the federal poverty level, which is, of course, is adjusted for household size and high cost of living areas. And here I want to pause again just for a second and stress that, again, no Hep C patient living in the US that meets insurance and prescription and income criteria that HealthWell has set forth should have any obligation with regard to copay costs related to their Hep C medications, either now or in the future. And if you think you may qualify for our program, we certainly encourage you to submit an application. All right, so let's assume you've made the decision to want to apply, and you're probably wondering, what information do I need in order to apply? Fairly straightforward and easy to remember. Basic information. We'll need your age, and important to note that if the patient is under the age of 18, we will also need the parent and guardian information that is required. We'll need your legal name, your address. Again, you must be living in the United States. your phone number, your insurance information, your social security number, your household size, and your annual household income. Armed with that information, the grant process is very easy and quick to complete. There are 3 components to the process. There's qualifying for a grant, applying for a grant, and then if approved, utilizing your grant. And we'll touch on each of those in subsequent slides. So how does a patient qualify for hepatitis C assistance? Qualifying for that grant, for the Hep C grant, really couldn't be easier. In order to qualify, you must be living in the US, have health insurance, have an income that is less than 500% of the federal poverty level, as I mentioned previously, and you must be receiving treatment for a specific medical condition for which funding is available. Obviously, in the case of the Hepatitis C Fund, that would be hepatitis C that you're receiving treatment for in order to qualify. So you think you qualify, you've gathered all the information. How do you apply? It's really simple. There's 2 ways of going about it. You can visit us on our website, healthwellfoundation.org, and submit an application online, or you can contact our contact center at 800-675-8416. If you're approved, you'll receive instant notification, and an approval letter will be sent to the patient's home. Likewise, pharmacists and providers can log into their respective portals to download copies of those approval letters. And while I'm on that subject, for any providers and pharmacists who may be in attendance today, it's important to note that you may absolutely apply on behalf of your patients, but in order to do so, you would want to log into your respective provider or pharmacy portal in order to submit an application rather than submitting it via the website. Finally, utilizing your card, as I said, if approved, we offer instant access to your pharmacy card information, and you see a copy of what the card looks like there. That's all the information your pharmacist would need to run a claim in conjunction with your insurance to fill a prescription for your hepatitis C medications, and that's available to you as soon as your grant is approved. We also offer direct billing with providers and pharmacies, the ability to reapply after 12 months. And in some instances, some funds offer the possibility of grant replenishment. Examples of those replenishable funds include ALS, Dupuytren's, and gout. So with all that said, what's the scope of our program? How many people have we been able to assist? We're extremely proud of these numbers. Since 2015, we've been able to provide financial aid to nearly 24,000 hepatitis C patients. That equates to $149 million in grants awarded Hep C patients since 2015. Like I said, we're extremely proud of those numbers and the reach of the hepatitis C program, but we know there's more work to be done, and that's the goal of this webinar today, is to help spread the word that we're here and we're able to assist. So I wanted to leave you with this testimonial from one of our Hep C grant recipients, Len S. from Omaha, Nebraska. Len writes, 12 weeks later, labs showed no HCV detected. I was released from treatment because I was cured. The 12-week treatment cost would have been over $70,000. For a fixed income person and a retired educator, it was absolutely prohibitive. The staff at the specialist's office intervened with my insurance plan. It would have brought the cost down to around $12,000. That was still a very difficult thing for us. Along came HealthWell, working with the pharmacy involved, and a grant from them reduced my personal copay to $0. I gratefully and sincerely consider the foundation part of my life-saving cure. I will be forever grateful to them. I think that's touching and really hits home, and I wanted to share that with you today because I believe that more than likely everybody on this webinar today, if faced with a chronic disease such as hepatitis C in the scenario where Len described, would be facing the same obstacles and the same hurdles as far as getting treatment that they need. Thankfully, Len was able to qualify and receive a Hep C grant, but we know there are many more Hep C patients out there like Len who are in need of assistance. So again, and for the last time, I promise, I want to reiterate, if you or someone you know is a Hep C patient living in the US and you meet the HealthWell Foundation's insurance, prescription, and income criteria, you really should have no copay obligations for your Hep C medications, either now or in the foreseeable future. We really do want to see you thrive, and we're here to help. So please go online or call us today to submit an application. With that, I just wanted to provide you with some Hep C resources that may be of further assistance beyond our website. I won't go through them specifically. You see the American Liver Foundation, the Community Liver Alliance, and National Viral Hepatitis Roundtable that I mentioned previously. I also wanted to include the National Alliance for Caregiving. If there's any caregivers in attendance today, that might be a useful resource for you as you help your patient navigate the process. And finally, I wanted to switch gears just a bit and highlight a new feature that we're very, very proud to offer all patients, not just Hep C patients, and anyone interested. Real-time fund alerts allows anyone to track the status of HealthWell's diverse portfolio of disease funds in real time. This basically eliminates the need for those funds that are in high demand to log on and refresh your computer trying to submit an application when the fund opens. Patients and pharmacy and provider portal users can register to use real-time fund alerts via their respective portals. But if you're not a patient portal or pharmacy and provider portal user, don't fret. You can register for real-time fund alerts as well. To do so, simply go to our website, healthwellfund.org, click on the yellow portals tab, and then select real-time fund alerts from the drop-down menu. Finally, you want to click on the red create an account to register. And once you've registered, it's really that easy. You'll simply select the funds that you want to monitor in order to receive instant notifications when the status of the fund changes. And like I said, this is really a game changer for a lot of people, particularly for funds that are in high demand. This will alert you when those funds become open and closed and let you know that it is open and available to apply so that you can quickly submit your application. With that, I promised you contact information. Here it is. If you have any questions regarding anything discussed in the webinar today, you have my direct phone line and email address. Please feel free to contact me. With one caveat, if you happen to have an existing application or grant already in the system, please direct any questions related to those grants or applications to our contact center at grants@healthwellfoundation.org. And with that, thank you for joining me today for Help with Hep C webinar. I hope you found the information useful, and I'll turn it back over to Carla. I believe we have a few more minutes for questions.
We absolutely do. And thank you so much, Jeremy, for the very informative. And one of my favorite things about the HealthWell Foundation and their team is they go out of their way to, everything they explain is just it's plain spoken, and they go above and beyond to make the process super simple. Not to mention the access they have, and checking out their website, the access that you have to the staff, and how easy it is to navigate their website. There's a few things that I am just always blown away by. NeedyMeds and the HealthWell Foundation have been partners for a while, but Jeremy, when you share the amount of money that the assistance has translated into since 2015, and that the HealthWell Foundation has helped 24,000 Hep C patients, that's a staggering amount. And I really like that you showed that quote from a grant recipient, Len, from Omaha, because I think that basically sums it up, that there are a lot of people that fall, and we just talked about this on a presentation recently, there's so many people that fall into that underinsured category. They have some coverage to cover some of the things, but can't seem to make ends meet. And sometimes that meeting those ends are an enormous bill, like that $12,000 that was shared in that quote. So again, I know Jeremy said this a bunch of times, but not only don't hesitate to reach out to the HealthWell Foundation, but be sure to spread the word with your family, your friends, your neighbors, your loved ones, your patients or clients. So please do that. And I will keep up Jeremy's information. I will put up Jeremy's information and the contact information for HealthWell at the end as well, as promised. And we're going to get to those questions coming in, and I do see a few. And remember, if you do have a question, don't hesitate to type it into that question section of your GoToWebinar control panel. While those questions are coming in, and before I pass them along to Jeremy to get his answers, I want to remind everybody that NeedyMeds is another source of support if you are having trouble affording your healthcare expenses. And you can go ahead and find out what your options are through NeedyMeds in two ways. You can check out needymeds.org and click on that healthcare savings tab that I pointed out in the beginning of the presentation. And here is a list of our most popular healthcare savings categories you will find under that tab. Or you can reach out to our call center counselors, and I will provide that phone number also at the end. But for now, I'll say it out loud as well, which is 1-800-503-6897. Our counselors are available weekdays 9 a.m. to 5 p.m. We're in Massachusetts, so that's East Coast time. So there's a contact information for Jeremy, and as he said, don't hesitate to reach out to him unless you already have an existing grant with HealthWell. If you do, you're going to send an email to grants@healthwellfoundation.org. At the bottom of the screen, you'll see my email address, of course, the NeedyMeds website, and there's that 1-800 number again to reach out to our call center counselors. So, Jeremy, we do have a bunch of questions coming in for you, and let's get started with the first one, which is, if I'm approved for a Hep C Fund grant, how long will my enrollment remain active? That's a really important question.
That absolutely is, and it's one we get all the time. Any grant that's approved is good for 12 months, so from the date that you're approved, it'll be good for that 12-month period. And I'll add to that, we also get questions about what happens if a fund closes, how does that impact my grant? And the reality is it won't. It will still be your grant for that 12-month period, even if a fund closes. When we close a fund, it's simply to new patients and not existing patients who have already been approved. So one of my colleagues likes to give the analogy of booking a flight on a plane, right? There's only so many seats, and once those seats are full, United Airlines stops booking that for that flight. Same thing for our funds. We accept applications, patients are approved, they're given that 12-month window, and we simply stop accepting new patients until additional monies are available via that fund. But great question, and it is a 12-month period once you've been approved.
Thank you so much, Jeremy, and thank you to our audience for participating with questions. And I'm glad you went on to explain what would happen if you gave a longer example, because that was actually the next question coming in, so you're able to answer that before it even got posed to you. So the next question that we could move on to is, and here's another good one, what is the maximum award level for a Hep C Fund grant?
That is a great question and a very important question, particularly when you look at examples like Len that we discussed that was facing the $12,000 in out-of-pocket expenses. The maximum award level for the Hepatitis C Fund is $30,000. So in Len's case, it was certainly able to knock his copay responsibility down to zero. And with the $30,000 limit, can obviously go well beyond that $12,000 if patients have those additional costs.
Thank you so much, Jeremy. And this next question, I'm so glad it's being asked, and I think I know the answer to it, but I'm going to pass it along to Jeremy. And once you answer it, I'll tell you why I'm so happy that somebody asked it. So the question is, can I register to receive real-time fund alerts even if I'm not a patient or pharmacy provider?
In a word, absolutely. Anybody can absolutely register to use real-time fund alerts. Obviously, patient and provider would use their portal to register for those. But if you're neither of those and you simply want to follow real-time fund alerts to be made aware of any of our fund statuses, you can certainly do that. You simply need to go to our website, healthwellfoundation.org. You'll see a yellow portals tab at the upper part towards the center of the screen. Click on that and then click on real-time fund alerts and click on create an account, which will be listed in red. Once you register, you'll be able to choose any of the funds that you'd like to receive updates on. Very simple and user-friendly.
Yeah. Well, I would say not only thank you for the answer, but very simple and user-friendly, I think is a description we can say of HealthWell Foundation and their website in general, which I think is really important, because there may be wonderful resources for patients, but if it's too confusing or difficult to access, it may be a deterrent. And it's certainly a deterrent to spread the word when you feel like if you direct somebody to a particular resource and it's going to be too frustrating, they may choose not to share that information. So I think it's really important. I really like that Jeremy used those words, that it's easy and user friendly, because that, again, that describes the I believe the experience you'll have with the HealthWell Foundation. And the reason I was so excited that one of our audience members asked, can I register to receive those real-time fund alerts even if I'm not a patient, because that indicates to me that our audience members are doing what we hope they do for NeedyMeds and for the HealthWell Foundation, is to be sure that you're spreading the word.
Right.
Because even if it's not a particular resource that you can use at this moment, chances are there is someone close to you that can. So helping to spread the word is absolutely a way to participate and be an advocate. And of course, you can check out HealthWell Foundation and NeedyMeds on social media as well. So we do our best to keep this question segment brief. But again, if you do have questions, you can reach out to the HealthWell Foundation or NeedyMeds at the contact information on your screen. And again, if you asked a question we didn't answer, we will follow up with you via email. As Jeremy said, we also hope that you join us for the additional HealthWell Foundation webinar coming up. Is that July, Jeremy? I think we have it on the calendar in July.
That's correct. 21st, I believe.
Yeah, July 21st. And a reminder how you can do that. You can find upcoming webinars in two places on needymeds.org. You can find them listed under the Education tab, which is right next to that Healthcare Savings tab. Or you can find them on the calendar of events, which is on the bottom right hand of our homepage. Easy. So thank you so much to the audience for taking time out of their day to join us to learn a little bit about the HealthWell Foundation, their Hep C grant fund, and certainly to learn a little bit about NeedyMeds. We do hope to see your names pop up in future webinars and that you reach out to us for assistance or questions. A big thank you to my friend and colleague, Jeremy, for taking time out of his schedule to share his expertise with our NeedyMeds friends and users. Have a wonderful afternoon, everyone, and we do hope you all stay in touch. Take care.